Hello, welcome back to another video. In today's video, I'm just going to talk and tell you all why I quit my 9 to 5 job working as a CT technologist or a computed tomography technologist. So if you do not know, CT techs do work in the field of radiology, and you put the patient in like a round tube and the patient lay on this table. The table can go up and down from the floor, and the patient just goes inside of the machine and comes out the machine. So the reason why I quit my job, and then I'll tell you all the pros and cons of working as a CT tech. So the reason why I quit my job as a CT tech is because it's a lot that can happen with your license if you are not careful, and if you are working with someone who is just trying to clear the list, get patients on and off the schedule. So whenever you work in CT, you can work either in a hospital or you can work in a clinical environment. So I worked in both. I worked in outpatient imaging clinics and I worked in the hospital setting. So whenever I worked in a hospital, well, I'll start with the clinic setting. Whenever you work in a clinical environment or an outpatient clinic setting for a CT tech, then you will most likely be the only tech on the shift. And sometimes the clinic hours can be, you may have to do 7 to 3:30 or 8:30 to 5. Sometimes they've been letting techs do 7 a.m. to 7 p.m. if you want to do 12 hours. So it's different hours depending on what clinic you work at or what company you work for. And I'll throw in pros and cons while I'm talking, just so I don't have to worry about listing pros here and then listing cons there and then forgetting something. So I just throw in pros and cons together. So the good thing about working as a CT tech in the clinic is you have day shift hours, so you don't have to worry about working overnight. If you do have to work evenings, that's pretty much you staying to 5, or because you want to do 12 hours and get off at 7:30. So that's a good thing about working as a CT tech in the clinic. If in a clinic, you do have to work by yourself as a CT tech. So if you like working by yourself, that can be a good thing. If you do not like working by yourself, then that could be a bad thing. So I would say if you are a new CT tech or if you are an X-ray tech looking to cross train, and if you're new, then working in an outpatient clinical environment as a CT tech is going to be hard and it's going to be tough because you're not as experienced and you have to work by yourself. So I enjoy working by myself because whenever you work by yourself, you are responsible for your own mistakes. So if someone else make a mistake, then that's like a group effort. But if you work by yourself, then you're making a mistake by yourself. So I always like working by myself because you have to make sure that you're screening the patients correctly, you're doing the right scan, and if you work with a team, sometimes you may have someone who is just rushing to get patients off the schedule. Sometimes you may have someone who is just, following the schedule, making sure no mistakes. So in a clinical environment, um, the pay can vary depending on which facility you work for. You may or may not get paid to work evenings, especially if you're getting off at 5 o'clock. You may not be able to work evenings. Sometimes the facility may ask you to work on a Saturday. Sometimes, if you need the extra money or if you like working extra, that's not a deal breaker for you. But if you one of those types who just want to do your Monday through Friday or your 410s, then maybe you do not want to work Saturdays. So another thing is, whenever I worked in the clinic I worked at, I didn't have to do any type of biopsy procedures. I know it was like a lot of ortho, head scans, abdomen and chest scans. You do have to give contrast. So if you're one of those ones who do not know how to start IVs, then working in a clinic may be like a little challenging for you because you will have to start your own IVs. So either you have to call for help or you have to like maybe tell the patient they may have to come back if they are a hard stick, maybe hydrate. So that's one of the cons about working in a clinic is if you're not as good at starting IVs, then the patient may be a hard stick for you. And then working in a hospital as a CT tech, it's pretty busy. Well, even in the clinic, it's busy because you have a patient every 30 minutes. You may have a patient every 15 minutes. So if you're doing a CT scan in a clinic, they are going to schedule the patient every 15 minutes if it's like a CT head without, or a CT chest without, a CT abdomen without, any type of without studies, meaning without contrast studies, then you have to then they'll probably schedule every 15 minutes. If it's with contrast, then they will schedule like every 30 minutes. So that is helpful because it gives you time to clean the table, screen your patients. It gives you time to start the IVs and stuff like that. So working in the hospital, you will have more techs. You will probably have anywhere from 3 to 5 or 3 to 6 techs, depending on what clinic or hospital you work at. So you will have to learn biopsy procedures because in the hospital they do biopsy procedures. I know they do them Monday through Friday. Sometimes if it's like a stat or if there is a tech there to do it, they'll probably do it on Saturdays as well. But for the most part, they try to keep the procedures during the week, especially depending on which type of hospital or facility you work at. So in the hospital, you probably will get paid a little bit more, and that's because you have evening shift dip, you have weekend shift dip, you have holiday shift, extra pay. Some clinics they close on holidays, so that may be a thing where the clinic may not be open on a holiday. But just check with whatever company you're working for. And then another thing is you may have it to where the ER is busy in the hospital, especially on rainy days. So every time it will rain, because I'm a PRN travel tech, so I travel to different places, different modalities. So every time it would rain and I was scheduled to be in CT, I just knew the day was going to be crazy because whenever you work in a place, especially if you work in a big city, and if it's raining, then you have accidents, you have falls, you have broken bones, you have head trauma, someone got into a car accident. um, it's like a lot goes on whenever you work in a hospital and it's raining. So that's another thing you can keep in mind if you want to work in a hospital. I'm just giving the pros and cons because I worked in both settings. Another thing is whenever you work in the ER department, because in a hospital setting, you'll have the outpatient side where you do outpatients, and then if they have multiple scanners, you may do outpatients on one scanner, you may do inpatients on another scanner. But if they don't have multiple scanners, then you'll do outpatients and inpatients and biopsies on the same schedule. In the hospital, the schedule can be kind of spaced out depending on if you work in a big facility or a smaller facility, where it's not so much that it's a patient every 15 minutes or every 30 minutes. Sometimes they give you like a break in between. If you work it just depends on what type of facility you work at. So working in the ER department, you may have maybe 2 or 3 techs working with you. It can make it helpful, but it also can make it challenging. So now I will get into like a lot of the cons of why I decided like CT is not for me. I really don't want to work in it a lot or work in it anymore. And that's because if you are working at a place and you're working with someone is liable to not screen somebody correctly. You have a lot of techs who just want to rush, get patients in and off the table. Yes, you have to be efficient, but not to jeopardize a patient's safety. You have to know how to screen your patients properly. And whenever you're working with some people aren't verifying the allergies correctly, which is allergies to iodine, verifying that the patient, oh, they drink contrast, so we have to scan them in an hour, versus they drink contrast, so now let's scan them in 10 minutes. You may have someone who don't wait that hour. They say, no, we can just scan them now and get them in 10 minutes. 10 minutes not enough time for the contrast to just work in the patient's system. So you also have people not paying attention. Maybe they missed something on the order. Maybe the doctor ordered a CT head and a CT neck, and the tech told you just to do a CT head. then now you're getting in trouble because you didn't do the wrong procedure or you didn't finish doing a procedure. And what if that patient lived far? Now that patient have went home and may have to drive 30 minutes to an hour to come back to the facility to get the scan done. And then you also have, sometimes someone may tell you, go get this patient, for me, and they get the wrong patient, or you give the patient um, not the right contrast or something like that. So it can be challenging whenever you work with a lot of people, and you may have someone who don't want to go transport a patient, because in some hospitals you have to transport your own patient, especially if it's in the ER setting. Sometimes they have transported, but sometimes they don't. So if you have like a small ER bed or hospital, then they're gonna want you to go and get your patient, bring them to the CT department, which is sometimes it's not far depending on what hospital you work at. So you may have a lot of people on the shift, but nobody want to transport, or someone just want to sit and scan, or someone just want to sit and talk. And whenever you go through a lot of stuff like that, it just can take a toll over your body mentally and physically, because now you're doing all the work, now you're doing all the scans. So to avoid losing my license, I'm like, unless I find a place where I'm working as a CT tech by myself, I can't no longer work where it's like a lot of people, because you're going to have someone who, someone is helpful, then someone don't want to work, someone don't want to scan, someone don't want to learn to scan, someone don't want to do biopsy. So it's just going to be one or the other that I just named. And it's not worth getting your license taken, because if you're doing the wrong scan on patients, now the wrong patient is getting the results, or you having the wrong surgery being done, or if you have someone who have to give contrast and they're not verifying that the patient is allergic to this contrast. Now you done had an allergy and it was in their chart, in a patient chart, that they are allergic to contrast. And then another thing, charting. Sometimes, depending on where you work at, you have people charting under the same screen. Like I've had someone chart under my name, trying to argue with someone, and I'm like, why are you arguing with this person? Because you think you're arguing with this person, but you're actually arguing with this person under my name. So they're gonna think I'm arguing with them, when in reality you're arguing with them. So that's another thing. A lot of these things can get you in trouble, can get your license taken. So I'm like, I would just rather either work by myself or not do it at all, because you don't want to jeopardize a patient's safety and you don't want to jeopardize your license. So I just chose to just step away from it, either from it forever or just for a second, until I can find a place where I'm just able to work by myself and be responsible for my own mistakes. And yeah, whenever you work in CT, you can make a lot of money, because they need people. It's just so fast paced. Patients are in and out. They need people. So if someone calls in, then you may be asked, hey, can you work? They'll pay you extra money to come in, So, and then if you work night shift, deep nights, then you get paid probably at least $5 to $7 extra more, depending on where you work at, and depending on if it's weekends as well. So that's some of the pros and cons of why I just decided to not be a CT tech anymore. I still have my license. I still do my CEUs for it. I just don't work in it right now. I haven't worked in it in a while. If I do decide to work in it again, it has to be where I'm at a place by myself, working by myself. So hopefully I answer your questions on the pros and cons of working in CT, and why I decided to just not do it anymore. If I didn't answer your questions, you can feel free to leave it in the comment box. I know it didn't take me long to get my license. I cross-trained from X-ray to CT and just took like a small course from a college. It was very short. They don't have that course anymore. And I just did my clinical at a place, a local hospital. So hopefully I answered all your questions. If I didn't, feel free to leave it in the comment box for me. And thank you all for watching. Once again, my name is Marian.